You are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Daniel Open. Today's section, I take you through an aspect of the thorax. My friends, today I'm going to take you through something called pleura. Okay, now one thing that everyone is aware about the pleura is that it is a serous membrane. Now if you go to my orientation or introduction bit to anatomy videos that I've done already, you get to know that I've explained all these serous membranes to you. But there's something more which I will tell you, that yes, although we know that this, pleura will have that portion which will be intimately associated with the lung itself, okay, by way of the visceral pleura, because whenever we talk about viscera, we are talking about an internal organ mainly derived from endoderm, okay, and of course the wall in which this lung, okay, dwells will also be covered, okay, by this, parietal, pleura, because whenever you talk about parietal, it got to do with wall. My friends, there is some more things that I want you to know about the pleura, which most of the times in your classroom, that will not be revealed to you. That is why it is my job as the noted anatomical prophet to take you through that one. So my friends, in this meeting, I will tell you about the parts of the parietal pleura, bring in some kind of clinical thing in here. I will explain that one to you. And then also, we will also look at what we call the visceral pleura. Whenever this visceral pleura, it invests the substance of the lung itself, okay, it divides it into some anatomic, functional, and surgical units, which we call bronchopulmonary segments. So my friends, I'll be taking you through that one today. And so without wasting my time, let's set the ball rolling. So I begin with pleura. Okay, so whenever we talk about pleura, yes, already I've mentioned it to you, it is a serous membrane. But remember that it is bilayered. When the lung invests, okay, through this pleura, then we have that portion which is intimately associated with it, which we are calling it, of course, the visceral pleura. Okay, that is something we've seen. That this pleura, we can say that we have that portion, which we call it the visceral pleura. The visceral pleura, which is intimately associated with the lung itself. Then in the wall in which this lung dwells, that region, we will have what we call the parietal pleura. Now, one thing that for now I will tell you is that before I come to this visceral pleura, this parietal pleura itself is going to have four main parts, which I want you to know. Okay, so quickly, just sketching something briefly, just to show you that. Okay, so let's take this to be, okay, the lung. Okay, the lung. So if this is the lung, then one thing that I will tell you, let me use a different color for this, or it doesn't matter. Let me use this to show you. If this is our lung, then what is going to happen is that this lung itself, okay, will be, of course, covered intimately by this thing that I'm trying to draw around it. Okay. So what I have over here is my lung. Okay, let me call this is the lung. But this lung, okay, what we've seen is that there is something around it, and that is the pleura we are talking about. The one which is intimately associated with it, okay, like this portion of, okay, that we find over here, becomes your visceral, pleura. Okay, it's intimately around the lung itself. Now, one thing you see is that, assuming I have my let's say this S-shaped bone around over here, okay, and this S-shaped bone which is horizontally placed in the human body, the only S-shaped bone, that is the clavicle, the collarbone, the beauty bone. Okay, so let me take this to be the clavicle. Now, that portion, if this clavicle is my reference point, then that portion of the pleura, okay, especially I'm talking about this portion of the pleura which are called the parietal pleura. Okay, so here, what you will see is that this is the parietal pleura. That is the wall, the one outside. The one which is intimately around this lung itself becomes the visceral pleura. That's what I'm talking about. That is why the space which will be captured between the parietal pleura, okay, and the visceral pleura will be called the pleural cavity. That is what we've explained already. That becomes the pleural cavity. Now, this time around, pay attention to the parietal pleura. So that portion of the pleura which is above the clavicle. Now, if you look at the clavicle is over here. Now, if I go cranial to the clavicle, I'm going to the root of the neck. So that portion of the lung which is above this clavicle, very close to the root of the lung, root of the neck. And whenever we talk about neck, we know another word for neck, which is an adjective which describes the neck, is cervical. And that is why this portion, okay, will be called cervical pleura. Cervical pleura. Okay, and whenever we talk about cervical pleura, talking about that portion which is, okay, above the clavicle, close to the neck. Now, over there, it doesn't get to the neck entirely because there's a membrane, okay, which bridges, okay, that space between, of course, the neck and the thoracic cavity. You know, we have what we call superior thoracic aperture, okay, where substances entering or leaving the the thorax from the neck will have to traverse through. So it is bridged by what we call a membrane, and that membrane is called substance fascia or suprapleural membrane. And that is why that membrane which will be above will be called suprapleural membrane. So I'm talking about the cervical pleura over here. That is one part of what we call the parietal pleura. Now, because we are in the wall, okay, where the lung dwells, we are talking about the thoracic cavity. And on either side, okay, if you come this way from here, on either side, you see that the ribs are there. And anytime we talk about rib, the adjective that describes the rib is what? Last week we came across it. We've described all these things already, times without number. Your answer is costal, and that is why this portion of the pleura will be called costal pleura. Costal pleura. Yes. Now, last week too, I told you, or we've explained it already. Now we are in the thoracic region, where the lungs, the heart will dwell. Now, when I go downwards, I'm going to the abdomen. And we said that the physical barrier which separates the thoracic cavity cranially from the abdominal cavity caudally is what? That is the diaphragm. And so that is why this portion of the pleura will be called diaphragmatic pleura. So that's the adjective that we are going to use to describe it, diaphragmatic pleura. Diaphragmatic pleura. Okay? And then over here. Now, there's another portion of the pleura over here. Now, in the region of the thorax, majority of the space is captured by the lungs. Now, we have two lungs, the left lung and the right lung. They are capturing a lot of the space. Now, the midway, in between where the two lungs are, the midway is something we've described already. That is something in Latin, okay? We call it midway, and the name is mediastinum. And that is why this region of the pleura, which is very close to the mediastinal area, will be called mediastinal pleura. So my friends, over here, we have what we call mediastinal pleura. Okay? So these are the four main parts that I want you to know. But lastly, one thing I want you to know about this diagram over here is that, now look at this. This is the costal pleura, this is the diaphragmatic pleura. The most dependable site where, for instance, if there's an infection of the lung region and excess fluid, which we call it pleural effusion, okay, get collected, where is it going to be? It's going to be at this region. Okay, so for instance, if the clinician, okay, thinks that, let's say someone is suffering from pneumonia, a lot of fluid, around, this lung, and precisely where is the fluid going to be? It's going to be captured in what we call the pleural cavity. That's the cavity between, of course, the visceral pleura and parietal pleura. That's the space where the fluid is going to be. But because of gravity and all that, what is the dependable site? And the dependent site, we are talking about that site where a lot of the fluid will get collected. And my friends, it's mainly at this point, which I'll put this black thing over here. It's mainly at this point, and my friends, that space over there between this costal pleura, okay, and the diaphragmatic pleura. So what do you think will be the name? We will call it costal diaphragmatic recess. So the nomenclature is so simple, okay, that we can understand these things. So that is why this region over here, we call it costal diaphragmatic recess. Now this is extremely important because this is where, if there are a lot of fluid in the pleural cavity, the pleural effusion is going to be tapped. Yes. So now the question that we need to also understand is that it is tapped at what level? What level do we normally tap this pleural effusion? My friends, it's at the level of the 8th intercostal space. Yes. What's the level? The level is the 8th. It's tapped at the level of the 8th intercostal space. Intercostal space. Now, why do we tap it at the level of the 8th intercostal space? Because largely in the larger population, what we see is that the lower border of what we call the lung, the lowermost portion, the lung, okay, together with, of course, this visceral pleura, is at what level? What level does it reach? And my friends, it's at the level of the 7th rib. The level of the 7th rib. That's where this lung, okay, will rib together with this visceral pleura. But how about the parietal pleura? My friends, for the parietal pleura, it extends to the level of the 9th rib, usually at the level of the 9th rib. And that is why usually we will tap it over here so that we don't puncture through the lung. Okay, we will tap that kind of pleural effusion, okay, from this level. But my friends, there's a catch. One thing that you have to know is that it's at what level are you tapping this? My friends, we are tapping it at the level of the mid-axillary line. So I'm interested in telling you that it is at the level of the mid-axillary line. Okay, mid-axillary line. My friends, you know it better than I do that whenever you talk about axilla, it got to do with the armpit at the level of the mid-axillary line, at the level of what we call the 8th intercostal space. That is what we see. So that's one appreciation that we have over here. Now, usually if you do it at the posterior aspect, we tend to come a bit upwards. You can do it at even the 7th intercostal space. Okay, that is what we see. Now, having seen this, then we are through with this parietal pleura that we talked about. And so right now, the focus is on the visceral pleura. Now, this visceral pleura, yes, we've seen that is intimately associated with the lung. That is that all? No, it doesn't end there. It invades the substance of the lung itself. Yes, so that it divides this lung that we're talking about into smaller units, which are pyramidal in shape. So what I'm trying to say is that this visceral pleura goes on to give what we call pulmonary septations. Pulmonary septations. And this pulmonary septations is needed to give rise to divide so that we get something called bronchopulmonary segments. Now, this is extremely important. Now, when sometimes we ask student questions regarding the bronchopulmonary segments, they tend to get confused. So over here, just pay attention. I'm going to demystify everything to you. Now, the question is that, what is this bronchopulmonary segment we are talking about? The first thing is that, if for instance, if someone presents with, let's say, a tumor, carcinoma, whatever, of any portion of the lung tissue, then what will happen is that we have to check which segment, by way of bronchopulmonary segment, is affected, so that it can be surgically resected, taken away, so that it doesn't spread to affect the remaining lung tissues. That's the principle. So God, in His own wisdom, thought it wise that this lung, okay, inhale a lot of things, it can be diseased. But for us to ensure that when the disease happens, it doesn't spread, affect the other ones, so that doctors are trained, okay, so that they can surgically remove it. Why? Because at the end of the day, they can be removed because we have the visceral pleura invading the substance of the lung, so that they are separated. Okay, so I have several units of them in there, so that they can, because of the pulmonary septation, the pulmonary safety in there, we can remove, these individual ones. So the first thing, let's think about this lung that we are talking about. When you take the lung, for instance, if I take the right lung, one thing that everyone is aware, in most of the general population, naturally, you find out that the right lung will have 3 lobes, and that is why I've explained in my previous videos. That is why we say that the right lung is larger than that of the left. Why? Because that of the left has only 2 lobes. That is what usually we see, unless of course there are some kind of anatomical variations. But by and large, we expect the right lung to be larger, having 3 lobes, and then the left lung to be smaller, having, of course, 2 lobes. For this reason, you know that we have the trachea, which is your windpipe. You know about that one. At the level of the carina, a very large cartilage, hyaline cartilage over there, then it divides into 2. It divides, giving us what we call the right. So, right main bronchus, and then we have the left main bronchus. One thing that everyone is aware is that the right main bronchus is shorter, okay? I mean, apart from being shorter, its diameter, luminal diameter is wider, and it is, of course, more vertical compared to that of the left main bronchus. We explained that one already in previous videos we've done. Now, what happens is that whether or not we are talking about right or left main bronchus, they will divide, giving rise to what? Secondary bronchus. And the secondary bronchus, one thing we know about secondary bronchi is that secondary bronchi are also called lobar bronchi. Lobar, like lobe, lobar bronchi. Lobar bronchi. And whenever we talk about lobe, lobe. So it's just like the number of lobes. So the number of lobes a lung has tells us the number of lobar or secondary bronchi. So as I told you, if it's the right lung, we are having 3 lobes. So it means how many lobar bronchi are you going to have? Or secondary bronchi are you going to have? You tell me 3. That of the left, because you have 2 lobes, there will be 2 lobar bronchi. Yes, that's what we see. Now, apart from that, the secondary or lobar bronchi also divide, giving rise to what? From secondary, where are you going to? Tertiary bronchi. Now, another name for tertiary bronchi is segmental. Segmental. Another name for tertiary bronchi is segmental bronchi. Now, the segmental bronchi are those ones which are going to aerate, give air to the bronchopulmonary segment. After all, you can see some segments in there, okay? The segmental bronchi. They are those ones which are going to aerate, give air to the bronchopulmonary segment. For this reason, now let's think about it. If it is the right lung, because it's larger than that of the left, then usually you don't expect that the same number of, segmental bronchi that we have, segmental bronchi, and for that matter, bronchopulmonary segment should not be the same with that of the left. Why? Because the right is larger than that of the left. Okay, that's what we see. So now let's think about it. If it is the right lung, we have what we call 10 bronchopulmonary segments. Now, it's as simple as that. We have 10 bronchopulmonary segments. But my friends, in the case of the left, now it's variable. It can be 8, it can be 9, and because of anatomic variation, it can also be 10. But usually we expect it to be, usually reduce the number compared to that of the right. So my friends, I'm going to explain that one to you. So now let's give some description about this bronchopulmonary segment we are talking about. The first thing, what did I say? Let me explain that one to you so that you understand the concept that I'm trying to convey over here. Now, assuming, let me draw this. Okay, now this is how the segments are. So this is one unit, one bronchopulmonary segment, another. Now what's the shape? What shape am I trying to convey over here? Can you tell me? It's more or less like triangular pyramidal structures. Okay, so when we ask you the shape of the bronchopulmonary segments, they are triangular pyramidal in shape. It's as simple as that. Now what did I tell you? I told you that this is the whole lung tissue we are talking about. But the visceral pleura, okay, let me say the visceral pleura, assuming is this one, is the one which is giving rise to all these septations, giving rise to the spaces between them. Okay, so let me just assuming we have the visceral pleura all around. This is the visceral pleura I'm trying to tell you. Okay, over here too we have the visceral pleura invading, okay, giving us all these septations that we have. So there's a septation, and the septations are made by way of the penetration by what we call the visceral pleura. Good. Now, this pyramidal structures, one thing that we know is that what is the direction? The apex. So whenever I talk about apex, I'm talking about the narrow regions. The apices, okay, of these pyramidal bronchopulmonary segments, they are directed towards the hilum of the lung. Now, yes, it's something that let me just show you about the hilum. Already, the gateway. Whenever you talk about hilum, we are talking about gateway, where all those structures, the neurovascular structures, okay, will have to enter, okay, or leave the substance of the lung. So the hilum is at the mediastinal surface of the lung. So you can see some structures, okay, entering the substance of this lung. This area is the hilum. So what we are trying to say is that the bronchopulmonary segments, they are directed, the apices are directed towards the hilum of the lung. Okay, so that is what we see. Now, that's one of the characteristics. Number two, another characteristic that we've seen is that this segment is aerated. I want to tell you that it's aerated. Now, let me tell you. So, for instance, what did I say? It's aerated by what? Tertiary or segmental bronchi. So, for instance, I may have my tertiary. Now, these represent the alveoli, okay, alveoli of the lungs, you know that. And so what I'm trying to say is that this is what is a tertiary bronchus. This what I'm trying to show over here is a tertiary bronchus. Okay, so that it will give air to this bronchopulmonary segment. Now the same thing will apply to the adjacent ones. They will have their individual, okay, segmental, bronchi. That's what we are talking about. So as I've told you, the correlation is that the number of bronchopulmonary segments will tell us the number of tertiary bronchi the lung will have. Now, apart from that, one other thing that we have to know is that these bronchopulmonary segments, there will be some kind of, they will have to also get their kind of arterial supply. Now, in the lung, usually the artery we talk about is the pulmonary artery. Okay, the pulmonary artery. Now, tell me, pulmonary artery, is it going to carry oxygen poor blood or oxygen rich blood? Yes, I'm sure you will tell me that it's going to carry what we call oxygen poor blood. The reason is that all arteries postnatally will carry oxygenated blood except the pulmonary artery. And that is why I have to use blue marker, okay, to tell you that the sort of artery, okay, that this this pulmonary artery, the sort of the content, the blood that is going to carry, okay, is going to be what we call oxygen poor blood. And so that's what we are going to have. We will have what we call the pulmonary artery. Let me show you that one. Let's say pulmonary artery. Okay, going all the way, my friends, is going all the way, supplying, taking this deoxygenated blood to the level of what? The alveoli. Now I want you to know the level at which this pulmonary artery will give off all those branches to reach. And my friends, is going, this is the pulmonary artery, let me put it down. Pulmonary artery. Already, whenever we say pulmonary, it got to do with the lung. Okay, so it's going to the level of these are the alveoli. Okay, that is what we see. Now, is that all? No. There will be another artery which I want you to know. That is something we call bronchial artery. Now, it's not only because this one is carrying oxygen poor blood, okay, then there should be another one which should be carrying oxygen rich blood. And my friends, that one we call it bronchial artery. Bronchial artery. Now let's look at that bronchial artery. My friends, the bronchial artery is coming, okay, so let me use red because it's carrying oxygenated blood. Bronchial artery is coming all the way, so let's say about here. Now look at the level. Pulmonary artery came to the level of the alveoli. Why? Because that is where exchange of gas is going to take place. We'll have, capillary bed over here. That's where exchange is going to take place. So that the oxygen poor, yes, there will be that kind of exchange over there. But I'm talking about this one, the bronchial artery, because it's carrying oxygen rich blood, it comes to this level. And my friends, what level am I talking about? It is something we call the segmental. So let me put this one over here. This one over here is the bronchial artery. Bronchial. The adjective, okay, describing the bronchial artery. Now, to what level? So the respiratory bronchial. Now, my friend, this time around, I'm not talking about bronchi, I'm talking about bronchial. So the level of respiratory bronchial. Yes, that is what we see. Now, is that all? No, that is not all. Before I go to the third one, where is the final one possible for today, I want to tell you something about this bronchial artery. Bronchial arteries are extremely important. That you know, sometimes we ask questions about it and students fumble giving the right answers. Now the question is, for the two lungs, the left and right lungs, are there any variations? Are there any discrepancies regarding the number of bronchial arteries? Yes. If it is the left lung, we have 2 bronchial arteries. Interestingly, although the left lung is smaller, okay, we are rather having 2 bronchial arteries. In the case of the right, we are having one bronchial artery. Yes. Okay, that is what I'm trying to tell you. And so if it is the right one, we say we are having one. Right is one. But for left, we have two. Now, where are those arteries coming from? Okay, so the bronchial arteries, the left bronchial arteries, I want you to note that one also, very important, extremely important. Now, whenever it is the left bronchial artery, let's put some asterisks and put some points down. If it's the left bronchial artery, I said that one, we are going to have how many? We are going to have two. Two, very important, that there will be two. And both of them are directly arising from the descending thoracic aorta. And that's an important thing I want you to know, that they will arise from what you call the descendant. Let me put it this way. They will be coming from direct branches of what you call descendant thoracic artery. Yes, that is what we see. Now the reason is that left, the aorta is very close to the left. So if, for instance, if someone is very close to me, then the person may, benefit double portion of what I give. Yes. You understand what I'm saying? The person is so close to you, so you are not going to give the person one. Because the aorta is towards the left side, it's more towards the left side, that is why it is giving the left lung two bronchial arteries. Very important. But my friends, it fails to directly give some to that of the right, because a bit distant from the aorta. You understand the logic behind these things? And so in the case, okay, of what we call the left, which we have to understand that one also, in the case of the the right bronchial artery, right bronchial artery, how many did I say we are going to have? We are going to have just one. And my friends, where is this one coming from? Where is the one going to come from? My friends, it's going to come from the aorta, but not directly from the aorta, indirectly from it. Because the aorta, as it descending thoracic aorta, will give off a branch. Okay, the intercostal, okay, from 3 to 11 posterior intercostal arteries. Last week we appreciated that one. My friends, I'm interested in the third posterior intercostal artery. So it means the first branch coming directly from the aorta as the posterior intercostal artery is the one which is going to give rise, okay, to what we call the right bronchial artery. So I want you to note that in the case of the right bronchial artery, it will be coming from the right third posterior intercostal artery. Okay, that is what we are going to see. Intercostal artery. Right third posterior intercostal artery. I want you to know that. Very examinable. Now finally, still on this bronchopulmonary segment, what we see is that there will also be another artery. We've seen, there will be another vessel. We've seen what we call the, pulmonary artery. So how about the pulmonary vein? So my friends, the veins, they are not within the segment. They are intersegmental. So they will run in the septation between the segments. Okay, so I want you to know that in the case you have a vein, but the veins will be running over here. But the vein, pulmonary vein will be carrying water with blood. You will tell me that they will be carrying oxygenated blood. So I will use red to show it that this, okay, let's say it's running all the way, it's coming. Okay, this is what we call the pulmonary vein. And pulmonary vein will not be within the segment, it will be intersegmental. In between the segments, that is where the pulmonary veins will be. Okay, so that's the bronchopulmonary segment we're talking about. Now, my friends, there's the last thing that I got to tell you. I've told you that the right bronchopulmonary segment, we are going to have 10. That of the left will be variable 8, 9, and 10. Let me explain that one to you, and we bring this class to a close. So we are still on the bronchopulmonary segment. Okay, so we have that of the right lung and that of the left. Let me make it this way. Okay, so I have that of the right lung. How many did I say? 10. Importantly, that 10. That of the left lung, as I said, is variable 8, 9, or 10. Okay, so now let's see. In the case of the right, now there's a simple mnemonic which will help us treat this one in a jiffy. I want you to know about that. A palm. A palm. That is what I'm talking about. A palm. Give me a palm. Okay? That is what I'm talking about. So the mnemonic goes this way. A or a palm. Okay? So I'm talking about a palm 3, for instance. Okay? Now, after you have written the a palm, write it again. Repeat it for me. A palm again. So with this mnemonic, so how many palms have you given me? You have given me 2. The right lung is having how many loops? 3 loops. Now with this a palm, now the first 3 will take care of the right lung. Sorry, will take care of the upper lobe. Okay, so I told you that there are 3 of them. Okay, for instance, look at what I have over here. Can you see there's some kind of fishes separating them? So there's the upper lobe. I go to the middle lobe, and I have the lower lobe. Okay, for the right lung. So what I'm trying to say is that a palm you've given me, the first a palm, take the first 3 letters for the upper lobe, and then the next 2 letters will be that of the lower lobe. It means that the last one will take care of. Okay, so for instance, this way. And then this one will also be separate for that of the lower lobe. The right lung has 3 lobes. Okay, so that is what we see. So that is for the upper lobe or the superior lobe. This is for the middle lobe. And then this is for the lower lobe. Okay, I'm talking about lobe. Okay, it's as simple as that. Now, A in anatomy, A usually, this A over here is towards the apex. I'm talking about apical. Apical, so A for apical. Apical lobe. Okay, apical bronchopulmonary segment. Now, the P over here is for posterior. Now, the A over here again, this time around it's not for apical, we've dealt with the apical. So if I mention posterior, then of course you know the opposite of posterior becomes what? Anterior. So this is anterior bronchopulmonary segment. Okay, it's as simple as that for the upper lobe. Now how about the lower lobe? Sorry, the middle lobe. L for what? Lateral. M for medial. The opposite of lateral is medial. So the nomenclature is so simple. Once you give me 2 palms, you are through with this. Now, my friends, how about the lower lobe? Because we see the same nomenclature as what we have over here. And so the lower lobe, let's go through the same thing. A for apical. Now, my friends, this apical, you may also call it superior. Okay, superior. I'll come to it again. P, as we've seen, posterior. A is for anterior. L is for lateral. M is for medial. Yes, so it's as simple as this. But my friends, we got to distinguish between the nomenclature already given over here and that of the lower lobe. And that is why if something is at the lower lobe, then it's at the base, it's at the bottom. That is why we will give it another suffix to discriminate it from that of the upper apical we've seen already. And that is why we will add to it apical or superior basal bronchopulmonary segments. Okay, the same posterior basal at the base, anterior basal, lateral basal, and then of course medial basal bronchopulmonary segments. So that is what we have to know. Okay, good. Now, there's one more thing I have to tell you about this one that I've just written over here. Is that now this one, let me put the red thing around it. I have this red thing, let me put it around it. Because it's important for me. This highlighted region, which is the apical or the superior basal bronchopulmonary segment of the right lung, my friends, that one is that one which is the most dependent bronchopulmonary segment in supine position. Now, in the hospital, patients lie supine. Already I've explained these things to you so that your vertebral column or the dorsal aspect of your body is on the bed. So in supine position, which most cases patients will lie, that is that point where we have this apical or the superior basal to be the most dependent bronchopulmonary segment. I want you to know that. So hopefully whatever can collect mainly in this region. Now my friends, how about in erect position? So right now I'm in erect position. I'm not lying down. I'm not in recumbent position. In erect position, my friends, the mantle, okay, leaves the apical or the superior basal. It goes to the next in command, which is the posterior basal bronchopulmonary segment. Okay, to the right side. I want you to know that. Yes. So now, I told you that you have 10 bronchopulmonary segments. Can we count them? Yes. For the right, now we have 1 apical, posterior 2, anterior 3, lateral, okay, 4, medial 5, okay, apical or superior basal 6, posterior basal 7, anterior basal 8, lateral basal 9, and then of course medial basal 10. So I've been able to justify why we have 10 bronchopulmonary segment for the right lung. Now my friends, how about the left lung? And that's what we want to understand over here. And my friends, in the case of the left lung, don't give me palm yet, give me apesi. You know, there's this kind of local delicacy, especially in Ghana and some West African countries. You know apesi, like yam, okay? You cut them into pieces. So first give me apesi before you give me the palm. I want that. So first, so in the case of the left lung, give me apesi. So we are going to say apesi before you give me a palm. Okay, now these mnemonics are so you can play with them. Okay, it will make life easy for you as a student. APC. So now, how many lobes does the left lung have? You tell me there are 2 lobes. Yes, there are 2 lobes. So in that case, the first, this all the way from here will be for the, of course, the upper lobe. Okay, the upper lobe. So let me see, upper lobe of the left lung. Then this one, the remaining, will take care of the lower lobe. So let's look at the nomenclature again. Now A for what? Apical. So we go again. Apical. P for posterior. A again. This A, opposite of posterior, anterior. Now how about S? Now, anatomy, in your basic anatomy, S, usually we know about it. S is what? Superior. So I'm talking about superior this time around. Superior. And then I, opposite will be inferior. Okay? Will be inferior. But my friends, there is something. This one, now in the case of the right lung, you saw that the lower two of the first A palm took care of the middle lobe. So this lower two over here, there should be something special about it. Yes, in the case of the left lung, we don't have a middle lobe, but we have some kind of tongue-like process. From the cardiac notch, we have some kind of tongue-like process. Looks like the tongue. So it's not actually a lobe, but it comes out of the lung as the tongue. It's part of the superior lobe. That is why this superior and inferior bronchopulmonary segments of the left lung can also be called lingular. Lingular means regarding something which looks like a tongue. Lingular bronchopulmonary segments. Lingular. Okay? So we can say it's a complex together, lingular. Now, how about that of the lower lobe? In the case of the lower lobe, yes, we go again. A again is for apical. P is posterior. We don't have a problem with that. A is for anterior. L is for lateral. And then of course, M is medial. Medial bronchopulmonary segment in the case of that of the left. But what did I say? For us to distinguish between some of these things like anterior polypical from this, then what surface do we add? Basal. It's towards the bottom. So basal. We add basal to them all. Yes. You've seen that. But in most individuals, now pay attention, in most individuals, I'm going to do something. In most individuals, this anterior basal, let me highlight it, is fused with the medial basal. Okay, so in most individuals, there's that kind of fusion of these two. And that is why sometimes in your reading, you may not see anterior basal, you may not see medial basal. They will simply combine them and talk about anteromedial bronchopulmonary segment in the case of the left lung. So now let's count it. I told you that we are going to have 8, 9 or 10. Let's take the lower number. If you take the lower number as 8, then this 1, 2, 3, this complex will become 4, okay, 5, 6, 7, and then these two put together 8. Anteromedial put together, you have 8. Now, how about if it's 9? If it is 9, then what will happen is that this is fused, these are separate. Or it can be that you can say this is fused together as one thing, and then these are also separate. We'll give you 9. But if you treat them as separate entities, we are going to get 10 bronchopulmonary segments. Okay? This is extremely important that you understand this. My friends, I hope you find this meeting helpful. I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.